So what might our guiding principles be for taking this journey? And I want to offer 5, and these are drawn from a piece of work that Monitor and ourselves have done together over the past few months. It's the first fruit of a shared project to put together what we're calling a choice and competition framework, an ability for commissioners in the NHS to tap in and indeed providers in a relatively easy, straightforward way to the evidence about the use of choice and competition almost in real time as it develops. So we're evaluating and learning as we go along. And the first bit of this is to say what do we think should govern this journey. So 5 points. The first for us, and desperately important, and it comes right back to where we started, is patients must come first. The interests of patients, their outcomes, the quality of care, the experience of care must be the overriding principle for the deployment of competition and market mechanisms in healthcare. Patients must come first. Our second principle is we need to work on evidence, not ideology. This has been a debate which, in our view, has been far too clouded by people taking up ideological positions, to be honest, on either side of the argument, and spending far too little time in actively trying to develop and produce the evidence that will help us understand better how we can resolve the dilemmas I set out at the start. And I think that's anchors straight to the work that Anita and Paul are leading, but also it's a call to the service. You know, develop our case studies, let's capture them, let's be clear about them, let's really take seriously the evaluation of new ideas as they are implemented. Evidence, not ideology. Third, and quite important for us, and very consonant with what ministers have committed to in Parliament, is that commissioners should decide. So it should be for commissioners to decide how, when, and where to use choice and competition. And that's because it's the role of commissioners to be close to their communities, close to their patients, and always to be acting on their behalf. So it should be for commissioners to make these decisions. Fourthly, there must be no hiding place for poorly performing incumbents. I think some of the noise perhaps that we've heard about competition may have been a little bit self-interested from the point of view of providers who are concerned that if some of their current performance was opened up and that if the information was really there and clear, they might be feeling a bit vulnerable. That cannot be the intention of the way we implement competition, market mechanisms into the future. We cannot use this as a kind of a defensive mechanism to keep people out where there is evidence that for some services, in some circumstances, choice and competition will bring about benefits for patients. So in if you like, supplementing the commissioners decide principle, our role in NHS England, working with colleagues in clinical commissioning groups, will be to ensure that those decisions are properly informed by an understanding of the available evidence. So this is not a charter to do nothing. And finally, we want a principle out of experimentation. We recognise the paucity of the evidence base. We think the only way we're going to bring about some rapid improvement is to support, where this is what commissioners decide, to encourage and support experimentation, to be agile in the way we evaluate and we bring those lessons to a wider audience, and not be embarrassed to say if we think things are going wrong. Be agile, be quick, encourage innovation and experimentation in the NHS done in an honest and open way. So those are our 5 principles. Patients first, Evidence, not ideology. Commissioners decide. No hiding place for poor performers, and encouraging experimentation. And importantly, that's a set of principles which Monitor, in their competition role, have signed up to with us. That's a joint set of principles. And we believe that it's a good set of guiding principles that hopefully will establish not just a kind of a safe place to take this journey on, but one in which the interests of patients are always kept at the front of our minds.